Good afternoon once again. Today is Thursday, May the 28th, 2020. As you can see, just now I was wearing a face shield just to demonstrate that when you wear the face shield, you would have to wear it with the face mask as well for maximum protection. This face shield in particular is from the Boston University Alumni Association of Thailand. Of course, many agencies, many organizations are producing this in addition, of course, to the face mask. And I'll be talking a little bit more about the face shield later on. So first of all, I'd like to begin by saying that the spokesperson mentioned, of course, about the situation around the world. The number of infections around the world, right now the top countries are the United States, Brazil, and Russia. And Thailand remains at lower than the 70th rank, around 77th. And the World Health Organization, of course, has attested to the importance of the use of masks. And that, of course, is a habit now in Thailand. Very happy to say. Of course, we are preparing for the upcoming third phase of relaxed measures. Reminder to please remain cautious and continue the good hygiene practices to prevent further spread of Covid-19. We have to remind one another. We have to take care of one another, continue to do that. The spokesperson also recapped about the phase 3, wherein the details will be coming out soon, but in general, the phase 3 will include the opening of various business services in the business sector, in the department stores that are remaining. Secondly, it will also include businesses such as establishments in terms of sports training. It will possibly, most likely, also reduce the time of curfew, the hours of curfew, so to speak, in Thailand. And in the third phase, it will be mandatory for business operators and establishments to use the Thai Chana platform, as well as the consumers, the customers who visit the business establishments to use the Thai Chana platform when entering the business establishments. But of course, we will have to wait until the CCSA general meeting tomorrow, Friday, for all of this to be confirmed and the details to be issued for the third phase beginning in early June. So moving on to the general situation and number of cases in Thailand, we have recorded for today 11 new cases in Thailand, making the cumulative number of cases 3,065. The total number of recoveries and discharged is 2,945, as you can see on screen. The latest recovery is around 14, adding to this number. So 2,945 is approximately 96% of the total number of cases in Thailand. So that's a very good number. 96% in Thailand of those cases have already recovered. Those patients remaining in treatment in hospital on COVID is 63 and no fatalities. Fatalities remain at 57. As for some observations, the 11 cases that the spokesperson mentioned, all of them are actually from Thai nationals, passengers who returned on repatriation flights from India, Kuwait, and Qatar, and all of them were placed immediately into the state quarantine system upon arrival. So some details of the 11 cases. The first case is a female, age 32, a tourist who returned from India and stayed at a hotel in Samut Prakan province. The 6 cases in that group, there were 5 men and 1 woman. These are people who are working in the spa business in the country of Qatar and aged from 27 to 37, 27 to 37, and one of them is age 52. The third cluster of the 11 is the last 4 Thai nationals, all male, returning from their work site in Kuwait on the 24th of May, and they were found to be COVID positive on the 26th of May. These four Thai male individuals were aged between 39 and 51, and they had certain symptoms such as headaches and fever. And among this group of 11, some had symptoms such as the loss of taste, their taste buds, as well as muscle aches and sore throat and the like before being tested positive for COVID. Another observation is that out of the total number of cases in Thailand, approximately 20% are those that returned from repatriation flights. But of course, this group have all entered into the state quarantine or the local quarantines upon arrival. So from foreign travel, it is still a significant amount, around 20%. Another observation is that those who are confirmed with the COVID case, the majority of them are being treated in Bangkok, followed by the southern provinces and followed by the central provinces. Age range, the youngest is 1 month, the oldest is 97 years old, and the average age is 37. Also, as one analysis is that the active case finding, which Thailand continues to perform in risk groups, continues. These risk groups have been assessed and have been performed in groups such as those living in dense population communities, including those who are working in factories, those who are in prison, including prison guards and those incarcerated, those working in schools, immigration officials as well. So these are the risk groups that we have analyzed, and the active case finding is being performed on these groups in particular. Moving on to the compliance issue, yesterday's inspection of this business establishments totaled around 21,749, with a small number not fully complying. So hope that the business establishments will continue to commit to practicing hygienic standards as prescribed by the CCSA. Yes, and we have an English slides for you on screen on these clusters as usual. And moving on to the issue of Thai Chana. Today we also had, of course, the Inspector General of the Ministry of Digital Economy and Society giving a briefing. Yesterday, registered establishments using the Thai Chana platform is over 120,000 around Thailand. Out of the business establishments that used, for the public, around 14.7 million users around the country have used the platform, with accumulated check-in as 38.8 million and check-out 25.8 million, with 14.9 million evaluation. Now, as you can see, and as I mentioned every day, of course, the check-in and check-outs number don't correspond every day. So it means that the general public is mostly checking in business establishments and not checking out. Of course, if you do the math, 38 million minus 25 million is around 13 million. So does that mean that there are 13 million people who remain in department stores and stores overnight for a couple of days? I don't think so. I don't think so. But of course, we'd all like to do that, but it's not possible, of course. It just means that people who check in don't actually check out. So just to remind you that it's important to check out so that the accurate timing and the accurate number of people in certain establishments can be accurate. And when there are cases of infection in a particular source, then the people who have visited in that particular time and location can be contacted, and there will be more accuracy. So please be reminded to check in and check out every time that you visit business establishments to reflect the accurate density per area. Of course, we'd all like to stay in the malls forever, but of course, if you don't check out, it might possibly be an indication that people are staying in malls for 1 week or 3 days or five days, which is not possible, of course. So on a more serious note, the lowest score of evaluation for establishments is on the criterion of floors and frequently touched surfaces being regularly cleaned or disinfected. So that's the lowest score. So we hope that the business establishments around the country will continue to take note of this and improve on that criteria of cleaning floors and frequently touched surfaces. The Taichana platform that I mentioned, of course, the procedure in using is quite very simple. Just use your QR reader on the phone, on your smartphone, and read the QR in terms of checking in, read the QR in terms of checking out, and completing the store evaluation. That's the Taichana platform. Now, the Ministry of Digital Economy has been developing the Taichana platform. The Taichana platform, of course, will continue to be used in terms of using the QR code reader and everything, but they have developed this further to have an alternative mode of using Taichana. So they are developing the Taichana application now for both Android and iOS systems to improve, basically, fundamentally improve the user experience and effectiveness of contact tracing. And this will be fully operational in both modes, Android and iOS operating systems, fully, most likely very soon, most likely over the weekend. And the rationale for upgrading into an app, and as I mentioned before, the usual one using the QR code reader is still possible to be used. You can still use that, of course, depends on which is more convenient. And aside from that platform, the app is in addition to that. The rationale for using the app is first that, of course, to improve the user experience in checking in and checking out, because the users do not have to have a screen to read the QR code. They can just press check in and check out on a button on that application. Secondly, it does not infringe the user's privacy. It also resolves the issue of fake telephone numbers, as users will be notified with a one-time password, with an OTP, to verify the number used for that application. And if a case is found, of COVID is found, they will be notified via the application itself as well. And if you forget to check out of business establishments, the application facilitates the easy checking out of those establishments when you already leave the establishment. So if you go home and forget to check out of 3 department stores and 2 restaurants, you can actually do that through the Taichana application, which will be available to be in use fully very soon, most likely over this weekend. So everyone is encouraged to use Taichana, either the platform or the application, so that they can be promptly notified of the positive cases. It's vital in monitoring the spread of the disease as well as ensuring public safety. So moving on to the activities of the Thai embassies around the world, we of course have images for you about the embassy's work around the world. Just for a change now, I'll just perhaps show images of not of the work of the embassies around the world, but of people helping people around the country. As you can see, often we have images of foreigners helping Thais, Thais helping foreigners stranded in Thailand. So it's not only about the government helping Thai citizens abroad, but also the compassion is working here, right here in Thailand. As you recall, I highlighted some Westerners helping Thai citizens in the island of Samui, and also Thai citizens in a particular province helping a Russian national stranded at a temple in Ayutthaya in Thailand as well. So vice versa, we're all helping each other. So just as an image of this compassion, just to highlight one act of kindness during this difficult time, the French media has reported a story of a French family stranded in Samui province for months after their holiday was disrupted by the pandemic. And the family is actually impressed with Thai hospitality and have received a lot of help during their extended stay in Thailand. You see an image on screen today about this French family in Samui Island who have had an accidental extended stay, I would say, in Thailand. But of course, as you can see in the images, they are quite happy and have been receiving a lot of help while in Thailand. Another act of kindness, about volunteerism, about assistance, as I mentioned before at the beginning of this briefing, is that many people around Thailand have been helping each other, donating food. As you know, the pantries of sharing around the country, as we presented to you last week. and also the various organizations, cultural groups, communities. We highlighted the Filipino community, the Indian community helping Thais. Of course, associations, businesses, schools and universities have continued to do that across the country. So just as one example, the schools in Thailand, of course, have been assisted by many people around the country because of the lack of resources in certain schools. But of course, the education ministry is adjusting the policy with regard to these issues about school opening and the mode of education, of curriculum, of the mode of learning during the COVID, which is quite a challenge. And in due course, tomorrow, they will be announcing certain measures regarding this matter. So regarding the schools, today, as I highlighted to you, the face mask is very important. And this one in particular is the Boston University Alumni Association of Thailand. And today, they handed these, around 1,200 of these face shields, to the Minister of Education to be donated to schools around the country. And there are, of course, children's sizes of face shields as well. So this is just another example of the act of kindness, the compassion going on around the country. So the last point is about the inquiries that we received and addressed to the spokesperson as well. First is an inquiry received via Twitter. How does contact tracing using Thaichana work if a case of COVID positive is found? How will the registered users be informed of the case? How will they be given tests free of charge? So as mentioned, the platform and soon the application serves to alert all stakeholders, the owners of businesses, the customers. If a confirmed case is found, the platform enables the officials of the disease control department as well to trace the movements of infected persons. And they will be able to contact people who were in the same venue at the same time as the infected persons through the contact number registered and the information on the platform. And these people will be, those who are alerted of an infection will be eligible to receive COVID testing free of charge in designated hospitals. So just to end, I have a quote for you just to end from the World Health Organization, Dr. Maria Van Kerkhove, the technical lead of the WHO on infectious disease epidemiologist, on proper personal hygiene and containment. So I quote, "What we see as being successful are the fundamentals of public health." So just to elaborate, what we unexpectedly gain from this crisis is also the good hygiene practices, which is an essential part of the new normal. So this is all I have for today for the English language summary at the press briefing of the CCSA. I hope that you have a very good afternoon. Continue to advise, continue to remind each other, continue to take care of each other, and please stay healthy and have a very good afternoon, and we will see you again tomorrow. Thank you very much, and สวัสดีครับ